Hey everyone, how's it going? Today I'm working with a patient who has a chronic case of onychomycosis, a fungal infection in the nail that requires ongoing dedicated care. On top of that, she's dealing with a significant buildup of onychophosis, which is the thickened, hardened skin around the nail caused by excessive keratinization. I'm going to walk you through the procedure I'm performing to remove this onychophosis using a chemical peeling technique that I applied earlier. This method is amazing because it allows for a gentle removal process without causing trauma to the skin or nail, and it directly supports the treatment of onychomycosis since the fungus feeds on the keratin in both the nail and the surrounding skin. Right now, I'm starting the removal of the onychophosis layers. Using a spatula, I'm carefully scraping away the hardened skin that the chemical peel softened. This step requires a lot of care to avoid irritating the sensitive skin underneath. You can see how thick this onychophosis is. It forms almost a hard crust around the nail, which can press against it and even interfere with healthy nail growth. The chemical peel is key here because it breaks down the accumulated keratin in a controlled way, allowing me to remove this skin without resorting to cuts or aggressive tools. I'm working with light, precise movements to ensure each layer comes off smoothly without causing discomfort. I checked in with the patient to make sure she's doing okay, and she confirmed she's feeling comfortable with the procedure. Now, I'm going a bit deeper into the removal, using fine tweezers to pick up small fragments of skin that the peel loosened. Look at how much cleaner the area is getting. Before, there was a bulky layer of onychophosis, creating discomfort and pressing against the nail, but now the skin is becoming much thinner and smoother, giving the nail room to grow naturally. As a podiatrist, my goal here is to relieve that pressure and create a healthier environment for the nail, which also makes the antifungal treatments we'll continue using more effective. As a podiatrist, I always prioritize my patients' well-being. Conditions like onychomycosis and onychophosis can be really bothersome, causing pain when walking or even embarrassment about showing your feet. That's why I explain every step of the procedure carefully to ensure the patient feels safe and confident. And this goes for all of you watching too. If you're dealing with similar issues, know that these treatments can transform your daily life, relieving discomfort and boosting your confidence. But I always stress, consult a qualified podiatrist because every case needs a personalized, safe approach. In Brazil, foot care goes beyond just health. It's deeply tied to self-esteem and aesthetics, which is a big part of our culture. Many of you in the comments ask why I don't just remove the entire nail in cases like this. The answer lies in our approach. I focus on treating onychomycosis and onychophosis effectively while preserving the nail's appearance. My goal is to help the nail grow back strong, healthy, and why not even more beautiful than before. Not all professionals worldwide prioritize the aesthetic side, but here in Brazil, I work to balance health and beauty because I know how much that impacts a patient's confidence. I'd love to hear from you. Where are you watching this video from? Brazil, the USA, Europe, or somewhere else around the world? Drop it in the comments. I read every single one. Since there are so many, I reply little by little, but I love connecting with all of you. And here's the thing, about 90% of people watching my videos aren't subscribed yet. So, if you enjoyed this content, please give the video a like and hit that subscribe button. When you like, comment or subscribe, it helps show YouTube that my content is valuable and not low quality. I post new videos every day, packed with tips on foot care and podiatric health. So come along for the ride. Check out how the toe is looking now. The chemical peeling technique is truly incredible because it allows for a deep clean without harming the skin. Before, the onychophosis was forming a barrier that not only caused discomfort but also provided more food for the fungus since it thrives on keratin. By removing this buildup, we are reducing the fungal load and improving the effectiveness of the onychomycosis treatment. I'm finishing up the cleaning now, making sure no bits of hardened skin are left behind that could irritate the area or hinder nail growth. The toe is looking much lighter and more functional, and the patient is already noticing the difference in comfort. Here's an extra tip for those dealing with onychophosis or onychomycosis. Regular cleaning, like the chemical peel we use today, is crucial to prevent the buildup of keratin that feeds the fungus. This procedure relieves pressure on the nail and creates an environment less favorable for the infection. But please, don't try this at home without professional guidance. Every case is unique, and a podiatrist will know the best approach for safe, lasting results. To wrap up, I'd like to ask you to give this video a like, subscribe to the channel, leave your questions or experiences in the comments, and share it with anyone who could use some podiatric care tips. Taking care of your feet is more than just health, it's an act of self-love. A well-cared-for foot can ease discomfort, boost your confidence, and transform your day-to-day life. Thanks for watching, and I'll see you in the next video. Bye!